canine have, how these diseases can be prevented, and what is the way of treatment. So if someone have these knowledge of these things, then the health status of their dog can be improved. Now, role of vaccine. Vaccines are entered in the body of animals, have immune response, and as a result of the vaccines, the immunity or the immune system produces antibodies that fight against the actual virulent form of the microbes, that may be viruses, bacteria, and so on. No vaccines may be used especially for the highly contagious diseases of dog. Puppies vaccination age is about 28 to 42 days, or as directed by the veterinarian. Mostly puppies receive antibodies from their mother's milk that will remain about 2 to 4 months, and after that, proper vaccination must be started. And then the after each years or annually up to the whole period of the life. Now, the first very dangerous viral disease is the canine distemper. This is highly contagious viral disease. This not only affects the respiratory system but also the gastrointestinal system and nervous system. Sign of these viral diseases are there is cough, diarrhea, runny nose and eyes, and paralysis, nervous twitching if the nervous system is involved, and then there is convulsion. So these all are the symptoms of canine distempers, and this is a viral disease, so no treatment at all. Only the symptomatic treatment may be given, but uh, it is not successful. Then the second disease is the adenovirus disease. And the name of this disease is also adenovirus, or we can say canine infectious hepatitis, because liver is affected because of this disease. There is inflammation of the liver, so there due to this, mm, the name also given to this disease. And how this disease transmitted from one infected animal to the healthy animal through feces, through urination, through salivation of the infected animals. And the signs of adenovirus disease are: number one, fever, then hemorrhage, and finally tissue swelling. So, how this disease can be treated? Through the blood transfusion that will be carried out by experienced veterinarians and intensive care. Now, the third disease is called canine leptospirosis. This disease is actually caused by a bacteria, Leptospira canis, that is cause this disease. These zoonotic diseases. Zoonotic diseases are very important diseases because they are transferred from, they can be transferred from animals to the human. So care must be taken to control these diseases. So how this disease transferred? It is transferred through the nasal discharge, through the urination and saliva of the infected dog. So mostly signs of this disease are the, you can say, diarrhea, vomiting, fever, jaundice, and kidneys are also involved. So if the kidney are involved, then they, if recover permanently, damaged or lost. So actually, that's why we can say that it is very dangerous. So that the line of the treatment is the intensive care must be given to the puppies or the, we can say, dog that is in this disease through the antibiotics, mostly Sporosporin group of, you can say, antibiotics, and through the intravenous fluid infusion. But this shouldn't given by owners, but a veterinarian, a trained and a experienced veterinarian must be involved for this for the treatment of this disease. Then the fourth disease is the canine kennel cough. This is highly contagious. It is in viral infection. It is caused by the para-influenza viruses and Bordetella bacteria. The signs of this disease are dry, hacking, and chronic cough, and that lead towards the pneumonia. It is the inflammation of lungs. So if pneumonia, then there is a high fever, then there is a, you can say, anorexia, then there is the respiration issues. So all, it is a very dangerous disease. So that may be developed in young and old puppies. So actually, the next one disease is the canine parvovirus infection. I have treated canine parvovirus infection in the field. In many cases, I have treated the dog. It is caused by parvovirus group of viruses, and this is also a very dangerous disease, especially for the purebred uh, group of dogs breeds. So, how this is transmitted? This can be transmitted through the material of infected dog, and which material, that is fecal material. And the signs mostly seen, I seen in field conditions, mostly vomit, bloody diarrhea. Due to diarrhea, then there is, you can say, the rapid dehydration and the loss of so many salts that lead to lethargy and weakness. And there is also a fever because this is viral disease. So fever is also there. And how it can be treated? It can be treated through intravenous fluid therapy and through sporting therapy, depending upon the condition of the dog. Then the next disease is canine coronavirus. So coronavirus, as we all aware, this is actually very dangerous disease. It is a pandemic group disease nowadays, and many human beings infected to this coronavirus, and they lost their lives. So this is a very dangerous group of viruses, coronavirus. So if canine infected canine coronavirus, and it is also a contagious disease that affects the gastrointestinal tract. The signs mostly related are the vomiting, bloody diarrhea, rapid dehydration, lethargy and fever, and the treatment line of treatment is same as parvoviruses, intravenous fluid therapy, ringer lactate solution, normal saline. I have used different type of fluid therapy and with the supporting therapy depending on the condition of the. So this is a very very dangerous disease. Rabies. It is very dangerous disease. It is zoonotic disease. It can be it is transmitted from animal to human. That's why it's zoonotic and highly fatal disease we can say. And this is also a viral disease. And this disease is caused by a Lysa group of viruses. So Lysa virus actually cause this disease, and this disease can be transmitted through the bite of infected animals. So bite area of bite is very important for the onset of the symptoms of this disease. If the area of bite is near the brain, so infection and symptoms occurs very early. But if it is far away from the brain, so the symptoms take some time. So in dog mostly there are two forms of the disease. One is the dumb form, then there is Furious form. Dump form is the dog not active process of the you can say jaws and unable to eat and die. So it is very dangerous form because mostly owners don't know actually their dog is uh, suffering from rabies in dump form. So care must be taken because this is very dangerous one. And then there is a furious form. Furious form is a hyperactive form. The dog is very, um, you can say, angry, and he lost the his recognition of his honor, and he attacks every persons to bite. So this is also second form, but it can easily be diagnosed. So uh, both of the form of this disease are very dangerous, and mostly the sign occur in dogs that are infected through rabies are the inflammation of the brains. Nagri bodies are formed inside the brains, and as a result, there is an inflammation of the brain, which is called as encephalitis. And then there is also salivation, and there is also salivation hyperactivation. So nervous systems are nerves fully involved in this very dangerous disease, and there is no treatment of this disease. If the dogs infected must be shot down, and if because before the you can say onset of the signs, this disease cannot be cannot control. But if signs not occur and vaccination may be given, then hopefully this disease can be controlled through the vaccination. So if the people are infected through the rabies, a rabid dog bite the people, so they must vaccinate immediately so that this disease, a very dangerous disease, can be controlled. So there is a no treatment. Vaccination is only the treatment. So rabies vaccination before the onset of the signs and symptom of the disease may be fruitful. So then there is a vaccination schedule. So as I discussed, these seven important diseases, mostly these diseases are the viral diseases, viral in nature, but some one is also a bacterial disease. So mostly we have different groups of vaccinations that are present in the market, but veterinarians must be consulted regarding the vaccination of your pup, dogs and puppies. And then the second one, group of diseases are the parasitic diseases. Parasitic diseases are the diseases that are produced due to the parasites. And there are two main categories of the parasites: ectoparasites and endoparasites. Ectoparasites are the parasites that are present outside the body of the dog or the animal. And while the endoparasites, they are the parasites that are present inside the body of the animal. So, for example, tick, lice, flea, mange, mite, they are the ectoparasites, while the tapeworm, roundworm, heartworm, whipworm, and you can say there are also others group of parasites, blood protozoans, Babesiosis, Plasmosis, Theriusis. So Leishmaniasis are the parasites they are inside body of animals. So tapeworm, as the name indicated, tapeworm are the worms that are segmented and long. That's why they are called as tapeworms. So transmission of the tapeworms is through the ingestion of raw meat of the small mammals or through the larval stage of the flea that is also present in the soil. Now, what are mainly signs and symptoms? Number one, presence of flea on the infected dogs. Then tapeworms in the feces of diseased animals. So these are the common, you can say, signs. And the treatment of this infestation is through the anti-parasitic drugs that affect the tapeworms. Then second category is the roundworms. So mostly there are different categories of roundworm: ascarids, hookworms, whipworms, heartworms. So mostly the transmission of these roundworms or through the ingestion of infected feces in contaminated soil. So ascariasis, as uh, they are the roundworms, so they are long and thin intestinal worms. The mode of transmission of these worms is through the feces of infected animal. And what are the signs that one can see? Pot belly is very prominent sign of ascaris. Stunted growth, lethargic conditions, weakness, and in some cases vomition or vomiting. We can say these are the signs and symptoms. What is the treatment of this disease? The treatment is by the use of anti-parasitic drugs. So anti-parasitic drugs, especially anti-nematodal drugs, they are very effective against these roundworms. Then there are hookworms. Hookworms actually the worms that have hook. With the help of these hook, these worms attach themselves to the intestinal wall of the infected bird, animals, dog, you can say. Transmission. Mostly transmission is through the utero or route through the uterus. When the puppies are inside the, you can say, fetus in the form of fetus inside the uterus of their mother, or if the second route transmission is through the mother feeding to puppies. So these are two important routes through which this worm infestation can be transmitted. And then what are the most common signs of this disease? There are anemia, that is the loss of blood or deficiency of blood, you can say. Then there is dark deficiency, dark feces, stunted growth are the main symptoms and signs of this hookworm infestation. And uh, different antiparasitic drugs can be used to control this infestation. And then there are whipworms. So, as the name indicated, they present in the lower bowl. So that's why they are the whipworms. And the mode of transmission of these worms is through the fecal material or the contaminated soil. And when the ingestion of infected feces by healthy dogs, this infection may occur, or when the dogs go and sniff, you can see the soil that is contaminated with worms. This cause this infestation. The prominent signs of this disease are watery diarrhea, weight loss. So how we can treat this infestation? Through the deworming. So a lot of dewormers present in the market. but veterinarian is the final choice that can select a good dewormer for your dog. Heartworms. Heartworms, as the name indicated, the worms that are present, that live, are inhabitant in heart of infected animals. They are the heartworms, and as we know that they're in pulmonary arteries and pulmonary veins both have uh, pulmonary artery. There is deoxygenated blood, and in pulmonary veins there is oxygenated blood. But as veins carries deoxygenated, while arteries carries oxygenated blood, exception to pulmonary artery and pulmonary vein. So when these ones are present inside the heart, here they can move from heart to lungs and then also circulation, and where the blood gone they also gone. So this infestation actually much suffer the animals, and that is very dangerous. So how this disease can be transmitted? The transmission of this disease or infestation is through the mosquito bite. These mosquito bite the infected animals and then bite the healthy animals. Then this uh, disease can be transferred from one animal to the healthy animal. Then how we can treat or prevent this disease? So here is a test that is very fruitful test. The name of test is blood test, and this blood test of healthy dogs at early spring must be must be done. And if the blood test is positive, then treatment should be started immediately. And if it is negative, intervention should be uh, started. So this is a deworming schedule. So this schedule may vary from one region to other region depending upon the regional parasites present and by the guidance of the veterinarians. So there are three different types I have divided. Number one is puppy, then nursing dogs, and finally pregnant. Puppies, when the age of the puppies is about 2 weeks or 14 days, first deworming. Then at the age of fourth week or 28 days, second deworming. Then the age of 6 weeks or 42 days, third deworming. And after that, ninth week, 63 days, the fourth deworming. After the fourth deworming of the puppy, every month deworming must be started, and up to this will be up to the 6 month of age or 24th weeks. And when 24th weeks completed, then after 2 month deworming must be done in the page. So this is actually the schedule. By doing this schedule in you can say the health of the dog uh, can be improved. And the second category is nursing dogs. Nursing dogs, as per puppy schedule, as I discussed in this table. And pregnant animals, if the bitches are pregnant, then after 30 days of mating, uh, one can deworm, start deworming of their pregnant animals, not before 30 days, because this is actually very sensitive periods, and as fertilization, uh, the fetus, you can see the zygote is very small. That's why after 30 days, deworming, one can start deworming, not before the 30 days. Now, there are different external parasites. It is the second category of parasites that are also present outside the body of the dog. The most prominent form of these external parasites are the ticks, lice, fleas, flies, mites, and mosquitoes. So ticks, they are the common ectoparasites. Mostly they found in the early spring season, and they also responsible a fever, that is the Rocky Mountain fever. It is a very dangerous one, and it can be controlled by using the ivermectin or and insecticides, and you can say by this we can control. Then there is lice. Lice are very small parasites that are present at here this, and they also suck the blood, and as a result, the health status compromised. So how these lice is transferred from one animal to other through the touching of infected dog, or where the infected dog is present, and the lices are inside the soil, and a healthy dog comes there and it sits down there, or it sneezes something, and the lice have a chance to go up the body of the healthy uh, dog, and then they can produce external, you can say, uh, weaknesses and of irritation in the animals. So signs are biting and scratching of the skin. They are the mostly common sign of lice, and also dry coat. And then there is fleas. Fleas actually are the lead pencil size parasites, that is seen at the short ear of abdomen, or between the ears, or between the tail region at the base of the tail. So how these fleas transmitted? They can be transmitted through the infected animals or through the infected soils. And the most signs of this disease or the dermatitis is the inflammation of skin, and then there is a weakness. So treatment is through the anti-parasitic group of drugs. Mange. Mange mites. This is also mm, external parasite, and there are two types of mange: sarcoptic mange, and then there is demodetic mite. So the demodetic mange, sarcoptic mange is produced due to sarcoptic mite, and this is actually the itching and skin inflammation. Mostly in severe cases, there is loss of hairs. In demodactic mange, that is caused by the demodactic mite, and they are actually small patches of hair loss. It is also transmitted through genes. That's why it is heredity involved in this. And then this is mostly seen in the purebred dogs. And there is also another mites, that are the ear mites. As the name indicated, they are present externally, or we can say external ear. Dogs mostly shake their head and scratching of ears. So insecticides can be used to kill these mites, or as per recommendation of veterinary doctors. So these are actually the most important uh, diseases that I have uh, discussed, and it is just a superficial knowledge, but I try my best to help the dog owners about the common diseases that I have experienced and in my field, in my field experience, and I also uh, organize this. If you find this is a good video, you can just comment, subscribe, and like this video. Suggestion from your sides can be appreciated.